Uh, Thanks so much for joining us. It's great to have everyone here for this webinar. I want to say a special thank you to our speakers and to our moderator today for their willingness to participate in today's event, and looking forward to folks sharing some valuable perspectives on the Pandemic Fund and also reflections on the first call for proposals from the fund. That probably goes without saying, but the COVID-19 and its global impact really did underscore the need for more coordinated action to strengthen health systems that are more resilient to insults like pandemics, but also to mobilize the long-term financing for preparedness and response prevention that is necessary to ensure this kind of a resilience of the health system. So the Pandemic Fund launched last year during Indonesia's G20 presidency, and that I think that launch, the development launch of the Pandemic Fund, really did underscore a true commitment to channel this kind of dedicated and catalytic financing to achieve the end goal of creating more resilient health systems and ensuring their longer term financing is available. So over the course of the last year, the Pandemic Fund has rallied the support of 25 donors, amassing $2 billion in capital. And this has resulted in the allocation of the first Pandemic Fund grants, totaling $338 million, which will benefit 37 countries. This is actually an incredible result, both in and of itself, but also for the speed with which all of this has come together. And so it's a really remarkable achievement. As we reflect on the accomplishments, though, we really do have to acknowledge the challenges along the way as well. This was the first call for proposals, and the first out of the gate is often where we can learn some really invaluable lessons, and these can shape the approach. Certainly can shape the approach for the next call for proposals as well. And so we really do want to gain a lot of this insight. It's also important to recognize the overwhelming demand for the Pandemic Fund grants. Those far surpassed the available funding. And so the technical merit of proposals received during the first call was incredible. Of course, not all proposals even were able to be funded. So what this means is that to sustain and expand the fund's impact, we really do need to explore additional avenues for raising resources beyond official development assistance. And we've had this conversation in other fora as well. Philanthropies, private sector partners, and others hold some truly immense potential to bridge this gap and magnify our reach, not only for resourcing the fund, but also to complement co-investments and co-financing the proposals themselves. So the fund itself was designed to incentivize additional investments from recipients as co-investors and implementing entities as a way to really promote long-term sustainability. And I know Priya will speak to this as well. But the ability of the proposals to generate an additional $2 billion in investments really does underscore that governments and partners are really willing to invest. So that's a huge thing, I think, for us all to consider. There's great potential for collaboration as well between the Global Health Security Agenda and the Pandemic Fund. Everyone can recall that back in 2019, Global Health Security Agenda partners created the Sustainable Financing for Preparedness Action Package, and that group has been working together to make the case for investments in preparedness and the goal of achieving more sustainable financing for preparedness, doing a lot of advocacy and trying to also strengthen the interactions between the health and finance sectors to achieve this end goal. This kind of collaboration has really provided an invaluable platform for sharing country experiences and lessons observed and learned both, and really as a way to truly be useful in informing global policy and practice. So in April, this action package held the first webinar of this two-part series on GHSA, the Pandemic Fund. The first webinar engaged a number of GHSA member countries, Pakistan, Thailand, and Senegal, on their experiences while they were actively working on their Pandemic Fund proposals. They shared some insights on how they coordinated across ministries, how they identified which activities to prioritize for the funding, and decide with which implementing entities to partner. We also explored how GHSA and the Pandemic Fund could complement each other, noting how shared methodologies and approaches of, for example, the GHSA overarching target and the Pandemic Fund results framework can be leveraged to maximize synergies. And additionally, the action package working groups in GHSA can serve as resources for countries, helping them to identify gaps in health security capacity, but also to provide technical resources for proposal development and for implementation as well. So a good deal of resources there. So today, in part two, we'll hear from representatives from Ethiopia, the Caribbean Public Health Agency, and Rwanda, each bringing unique perspectives to this discussion. As Julie mentioned earlier, we do invite those joining us in the audience to share your experiences during the Q&A and also in the chat box. Our hope for this webinar is to leave participants with a comprehensive understanding of the Pandemic Fund, gleaned from the experiences of countries and regional agencies that deliver really strong proposals. This is knowledge that can undoubtedly enrich the endeavors of those looking to participate in the next round, the next call for proposals, and inform those working to ensure that the Pandemic Fund really can live up to its objectives. So let me stop there. I'm looking forward very much to the discussions, as I hope you all are as well, and I'll turn things back over to Julie. Thanks so much.
Thank you so much, Jose. Appreciate the introduction. We're now turning to our first presentation. Priya Basu, the Executive Head of the Pandemic Fund Secretariat, will be providing an overview of the Pandemic Fund proposals received during the first call, and then we will have a period for Q&A and discussion afterwards. Priya, I will get your presentation up on screen.
Thank you very much, Julie, and thank you, Jose, for that introduction. And thank you all for this opportunity to update you on where we are with the Pandemic Fund first call for proposals. I think there was some interest in the process as well, so I'll take you through briefly the process through which the governing board arrived at its decision on the allocations for the first call for proposals, and then I will share with you what that set of projects looks like. So let's turn to the next slide, please. All right, so we launched the first call really with an expression of interest call in January of this year, on January 31st, and this slide shows you the various steps we went through between January and July. This EOI was launched and it closed on the 3rd of February. It closed on the 24th of February. The Secretariat then screened these EOIs, worked with the applicants to try to bring more coordination around some of the proposals. Then the formal first call was launched on March the 3rd with a deadline of May the 19th. Then the Secretariat took a first level of screening of the proposals and sent the eligible proposals to the technical advisory panel. And it's great that we have with us Joyce and John, who's the vice chair of the technical advisory panel. The technical advisory panel then worked to review the eligible proposals and submitted its recommendations. At the end of June, they were then shared with the board, and then the Pandemic Fund board met on July 19th to make its final allocation decision. Next slide, please. All right, so a total of 179 applications were received for the first call for proposals by the May deadline. This represented 133 countries. This slide gives you a sense of what those proposals looked like, and they'll be shared with you. So I'm not going to go into the details, but the Secretariat then did a first level screening of these 179 proposals to check for eligibility. Next slide, please. And 135 were deemed eligible. These 135 proposals represented 132 countries, and the grant requests totaled 2.2 billion for these 135 proposals. And this slide just gives you a snapshot of what they kind of broad headline analysis that the majority of these proposals covered all three priority areas of the Pandemic Fund's first call, which, just to remind you, were early warning and disease surveillance, laboratories, and human resources health workforce strengthening. And that 82% of these proposals that came in were for single country projects, and then the remaining were multi-country or regional projects. Some 74% were had a One Health focus, and as you see on the bottom right-hand side, about 74% of them requested grant amounts of between 0 to 20 million per grant from the Pandemic Fund. Next slide, please. So what was the basis for this eligibility screening by the Secretariat? The Secretariat looked at all proposals that came in and reviewed them or screened them across 7 criteria, which are listed here, just really to make sure that they were complete proposals, that they met all the requirements that had been set out in the documentation for the call for proposals and so on, and that they covered the relevant priority areas. As you'll see in the middle column here, over half of the proposals were sent back to the applicants for clarification. So there was kind of a feedback loop here in a very compressed period of time, but we were able to do this. And the majority of proposals then were considered eligible. 75% of the 179 proposals that came in were considered eligible. So that resulted in a number of 135 eligible proposals. Next slide, please. So then those eligible proposals were sent to the technical advisory panel, which then did a very thorough review. I must say that we are blessed with a TAP, which is comprised of an impressive group of highly skilled, exceptionally committed, dedicated, diverse individuals, and also a great leadership. We have Joy here with us, who's the vice chair, and we have Mike Ryan, who's the chair of the TAP. I should also mention that we have a health technical team within the Secretariat that supports the TAP, and that is led by WHO colleagues, and Kara Dersky, who leads it from the Secretariat, is also here on the call. Between 30th of May and 21st of June, the TAP reviewed individual proposals, 2 TAP members per proposal. Then the TAP had a retreat, an in-person retreat in Geneva from the 22nd to the 25th of June, where they reviewed and discussed all 135 proposals, in a highly confidential environment. And then provided the summary scorecards and an overall report based on that review to the board, well, to the Secretariat. We passed it on to the board, and it made, that comprised the TAP's recommendations. Next slide, please. So these proposals were assessed by the TAP across six broad sections or 6 broad areas. Each proposal was reviewed for its context, rationale, objectives, demonstrated need, scope, priority, etc., ownership, commitment. Investment commitments were coming in from the countries themselves or the regional entities that were applying. Co-financing, which is what the implementing entities of the Pandemic Fund were asked to provide to complement the grant amount that was being requested from the Pandemic Fund. Coordination, collaboration across the different entities involved in the development and implementation of the proposals, co-creation, ownership by those who are requesting for the grant funding, implementation. So these were the areas, and this shows you, how these proposals were scored, how that the total was the total of 130 points was split up across these various areas. And then each proposal assigned one of three recommended categories. Well, so ultimately the recommendations that came from the TAP proposals were classified into highly recommended, and then not recommended for funding under the first round. 23 proposals were highly recommended, 26 were recommended, and 86 were not recommended. Next slide, please. So then, based on the analysis and the recommendations of the TAP, the Pandemic Fund Board had to make its allocation decision under the first call. Sorry, to move back to the previous slide, please. Yes, and it keeps jumping. The previous slide, please. Sorry, no, the next one, please. Next. Please stay on that one. Oh, I don't know why it keeps jumping. So I wanted to, I actually need the previous one, but what I wanted to share there was that there were three board agreed criteria. The Pandemic Fund Board agreed on three criteria three main criteria through which it wanted to select the portfolio of projects for support under the first call for proposals. Those criteria, which are on the previous slide, which is not showing up, I'm sorry, were they wanted to ensure, one, that there's a good geographical distribution to ensure balance across the 6 World Bank Group geographic regions, developing country regions. Secondly, to ensure a mix of proposals from low income, lower middle income, upper middle income, high income countries, with a priority for low and lower middle income countries. And thirdly, that they wanted to make sure that the portfolio that they support through the first call for proposals includes a good mix of implementing entities. And just for those who are not familiar, the Pandemic Fund works through channels resources, through implementing entities. These entities are meant to provide implementation support to applicants for the implementation of projects. And these implementing entities include 7 multilateral development banks, 3 UN agencies, and then 3 global health initiatives, which are the Global Fund, Gavi, and CEPI. And the 3 UN agencies are WHO, UNICEF, and FAO. And the 7 NDBs include the World Bank, IFC, African Development Bank, Asian Development Bank, Asia Infrastructure Investment Bank, European Investment Bank, Inter-American Development Bank, and so on. So these were the 3 criteria in order of priority that the board decided that it would apply in order to create that preferred portfolio of projects to support through the first call. And this was assuming that the total amount of funding that of projects that the TAP recommends exceed the envelope for the first call. And just to share that the board had agreed previously, and this was all in the public domain, that the total envelope for the first call would be somewhere between 300 to 350 million. So in the event the 49 highly recommended and recommended proposals that came from the TAP exceeded the grants requested by those proposals exceeded that 350 million envelope. And so, these criteria had to be applied by the board in order to arrive at a portfolio of projects to support through the first calls of proposals. Next slide, please. So this just gives you a snapshot of those highly recommended proposals. There were 23 of these proposals. Grant requests from that related to these 23 proposals amounted to $471 million. This just shows you what those proposals, kind of a top level analysis by income group, proposal type, proposed implementing entities, etc. Maybe in the interest of time, I'll move to the next slide. And then, so those were the highly recommended. These are the recommended, the 26 recommended proposals amounted to 501 million. I don't know why the slides, yes, 501 million. And so the total, so there was 471 million that was the highly recommended amount, and then 501.4 million recommended. So you can see that the total grants requested by these 49 recommended and highly recommended proposals exceeded the size of the first call for proposals, and so therefore we did have to apply those criteria to prioritize proposals for selection. Next slide, please. Okay. So then the Secretariat was asked to prepare a set of scenarios that would meet those criteria that the board had decided on, and provide a set of alternative scenarios for 300 million and 350 million that comprised, each scenario comprised a group of projects that together in totality demonstrated those three criteria that the board wanted to ensure, which is geographic balance, income balance, a mix of implementing entities. This just shows you the methodology that was applied to prepare those scenarios. Again, all this was decided before the TAP provided its recommendations. So this kind of analysis, what the criteria were going to be, how those criteria were going to be applied to develop scenarios and so on, was all put out on the public domain on the Pandemic Fund website, and then applied to the 49 proposals that were recommended or highly recommended by the TAP. Next slide, please. So the 6 scenarios were prepared, and then there were 3 scenarios for a 300 million envelope, and there were 3 scenarios for a 350 or somewhere around 350 million envelope. These were sent to the governing board. The paper is up again on our website, so please have a look at it. So you can see all those scenarios on that paper. When the governing board met on July 19th, it carefully considered each of the 6 scenarios, and again, reiterating its commitment to make sure that whichever portfolio scenario that it supports, must adhere to these important criteria of geographic balance across different income groups, mix of countries by income group, and diversity of implementing entities. And then they also examined each scenario for how much total leverage it would bring. In other words, how much co-financing and co-investment each scenario would bring. The number of countries that each scenario would allow the Pandemic Fund's first call to support, how many proposals had a One Health focus, how many, to what extent, there was gender equity that was embedded into the proposals included in these scenarios, and they also looked at fragile and conflict-affected situations, a number of projects in each scenario that provided support to FCS. They then, based on all these criteria and looking at the outcomes of each scenario, the board reached consensus on a certain scenario, which was scenario 2B as the preferred scenario, which was within the 350 million envelope. It was in fact 338 million. And I'll move to the next slide to give you a picture of what that scenario looks like that was decided for support by the Pandemic Funds board. So this scenario, which is really a portfolio of 19 projects, that this mobilizes, this provides 338 million in grant funding from the Pandemic Fund to 19 projects, which allows the mobilization of $2 billion in co-financing and co-investment to help 37 countries prepare for future pandemics. These 19 projects, they include at least 2 projects per geographic region, and there are more for some geographic regions. 75% of these projects are in low-income or lower-middle-income countries. 30% of the funding that's been allocated, that is the 30% of the 338 million, is allocated to sub-Saharan Africa, which is also the region from which we received the highest demand in terms of proposals submitted. The scenario represents a good mix of collaboration between implementing entities, between MDBs and UN agencies. There are 5 fragile and conflict-affected situations, states included in this, which are Ethiopia, West Bank and Gaza, Yemen, Burkina Faso, and Haiti. 68% of these projects, of these 19 projects, are tagged for One Health, and 47% are tagged for gender. If you want details on how we did the tagging for One Health and gender and so on, you can find that in the paper that I mentioned that's posted on our website. Next slide, please. So this just gives you a bit more granularity. Sorry, could we just move? Yes. So as I said, there are 19 projects. They cover 37 countries, $338 million in pandemic fund grants that mobilize almost 2 billion in, sorry, 1.8 billion in co-financing and 255 million in co-investment. Just to remind you, co-financing is the additional financing that is brought in by the implementing entities that are participating, so the MDBs, the UN agencies, and so on. And the co-investment, 255 million that's coming in co-investment, is coming from the countries or the entities that will receive the funds. This group of 19 projects, it includes 16 single country projects and 3 multi-country projects. This table shows you the distribution of those projects across different regions. So there are 2 single country projects from East Asia and Pacific that will benefit through this this first call, that are part of this scenario that the first call is supporting. Cambodia and Mongolia from EAP. Then from Central Asia, in terms of single country, there's one for Kazakhstan and one for Moldova. Latin America, there's one for Paraguay and one for Suriname. For the MENA region, one for West Bank and Gaza and another for Yemen. South Asia, projects for Bhutan, India, and Nepal. And for Sub-Saharan Africa, 5 single country projects that support Burkina Faso, Cabo Verde, Ethiopia, Togo, and Zambia. And then there are 3 multi-country proposals. One of them is a multi-country proposal for Central Asia. That is for 5 countries in Central Asia: Kazakhstan, Kyrgyz, Tajikistan, Turkmenistan, and Uzbekistan. This is actually a proposal that helps to develop a regional One Health framework and supports those countries in implementing that One Health framework. And there are 2 multi-country proposals for the Latin America and Caribbean region, one of which includes support to 12 Caribbean island states. This one really is a strong proposal in terms of regional collaboration. It includes not only collaboration for building regional capacity in areas like surveillance and labs and human resources, but also has a focus on regional and AMR capacity building. Then there is another proposal also for Latin America, which covers Bolivia, Brazil, Chile, Colombia, Ecuador, Paraguay, and Uruguay. The small island proposal, as Joy mentioned at the beginning, the small island proposal that has the Caribbean Public Health Agency as the regional entity that will where this capacity will be built at the regional level. Just a little more granularity on this portfolio of 19 proposals. You can see the geographic distribution on the left-hand side, both in terms of how this distribution plays out in terms of percentage of proposals and percentage of funding allocated. In terms of both the number of proposals supported and funding allocated, Sub-Saharan Africa stands at the top. 26% of the 19 proposals are from Sub-Saharan Africa, and 32% of the funding allocated under the first round will go to that region, followed by Africa, LAC, MENA, and SAR, and then East Asia and Pacific. It also shows you that 75% of the grants that will be allocated under the first call are for low and low middle income countries. There's a focus on One Health, on CSO involvement. Some 84% of the proposals have civil society organizations involved in both the development and or implementation of these proposals. And then on the extreme right side, you see where these proposals, how they stand relative to the GHSI. So about 57% of them scored in the second lowest tier of the Global Health Security Index, somewhere between 20.1 and 40, and 61.9% scored below 40. Next slide, please. So yeah, so just before I move to the next steps, I wanted to reiterate some of the points that Jose made in his opening, that, you know, the Pandemic Fund really is the first multilateral dedicated financing mechanism for pandemic PPR. We really are committed to doing things differently. And I think our first call proposals has shown how we can do things differently, because one of the things we said that we wanted to do differently was to make sure that in a highly fragmented global health financing architecture, we wanted to bring collaboration across different implementing entities and government partners. And you'll see when you look at the details of those 19 proposals, really every one of them, each one of them brings very strong collaboration across multiple entities. We also recognized when we set up the Pandemic Fund that you know, there's not enough support right now for regional and global level activities. And you'll see, you know, the regional proposals, the multi-country proposals that we are supporting through the first call, you know, really help build that capacity at the regional level, where there are big gaps. Another point that we had made when we set up the Pandemic Fund was that at the country level, actors were not collaborating around national health security plans, national action plans for health security. You'll see that these 19, you know, of the 19 proposals, the 16 single country proposals, each of them really, you know, brings together the NDPs, the UN agencies, and so on around supporting countries to strengthen their own national action plans for health security in the PPR space, and you know, draws on the comparative strengths and advantages of each entity, and they're really beautiful proposals. So we're soon going to be putting up summaries of those proposals on our website, and once they're up, we'll let you know, and I encourage you to please have a look at them. But also, you know, this first call for proposals was a learning exercise. We've all learned a lot. The Secretariat has learned a lot. The TAP has learned a lot. The board has learned a lot. I think stakeholders in preparing the proposals have also learned. So over the summer, we're going to, we've already started and kind of in-depth learning exercise where we've commissioned a stock-taking review that will, where we have an independent third-party entity that will conduct detailed interviews with all stakeholders to garner lessons, and then those lessons will be applied to the design of subsequent calls. And meanwhile, there's also an evaluation of the TAP, which will commence, which will also you know, help us get feedback on how things could be done differently the next time around. We also recognize that you know, there were many applicants that did not receive funding through the first call, and so the Secretariat will be following up with them in the coming weeks, and of course we're also following up with those who were awarded funds under the first call, and recognizing that it's really important to keep up the momentum. Particularly to ensure that those who did submit good proposals, you know, that weren't awarded funding through the first call are not discouraged, to keep everyone engaged. The Pandemic Fund Governing Board has decided that it'll aim to launch its second call for proposals before the end of this calendar year. So, you know, stay tuned. We'll keep you posted. Once again, thank you for your attention, and happy to answer any questions.
Hi, Priya. I apologize for the technical difficulties first. Sorry, it was harder to manage all of the moving pieces than one might think. I just wanted to note that there have been several interventions in the chat, basically at the same point, which is, will the countries that did not succeed with their proposals receive detailed feedback that will help them improve future applications?
Yes, so those who haven't been awarded, those that were eligible but didn't receive funding under the first call for proposals will receive detailed feedback. Right now, the Secretariat has gotten back to everyone, but not with detailed feedback yet. That detailed feedback is being prepared, and it will be sent out in the next in the coming weeks. So that work is underway for all 135 proposals. The 135 minus the 19 that didn't receive funding.
We have one question here, Matthew.
Yeah, thank you, the presenters, for these wonderful presentations. It's quite an eye-opener. And of course, thank you for the team for thought of organizing this. My question really is on the joint external evaluation and the national action plans. What role did they play in the decision-making in terms of which countries to support? I'm asking this because working with the World Health Organizations, the countries, when they are doing JEE, definitely I think WHO would be in a position to rank the countries in terms of vulnerability when it comes to pandemics and disease outbreaks. My fear is just basing on possibly how sound the proposals are, because countries that are most vulnerable are also likely to have weaker systems, and as such may not be in a position even to generate a very sound proposal that may stand against the other countries that have stronger systems. So it's just like there is quite an inverse relationship. Yeah, if you are highly developed, then you are at a lesser risk of having these pandemics. You have a high ability to withstand all these shocks. So I just felt, what role did the joint external evaluations and the national action plans that are based on JEEs had in terms of the decision making? Because I think this would really rank countries in terms of their vulnerability. Because I mean, even if you have weak systems, then you can't submit a very powerful winning proposal, but you are still at risk of these disease outbreaks that can spread to other countries. Thank you.
Yeah, Julie, maybe you can collect some questions and yeah.
Yes, thank you. And to add to Matthew's question, the other questions I think that we have time for are whether the second call proposal is anticipated to cover the same areas as surveillance lab capacity and health workforce. And if it would be, if there are thoughts about including, I think the output of the evaluation you're talking about, the lessons observed, both in including the potential for including the board criteria in the paper for future calls, and also whether you think there will be a revisitation of some of the questions moving into the next round of calls.
All right, so on the second call for proposals, the board has not yet decided what will, what areas it will cover. Like I said, they've taken note of the fact that there were very many good proposals, in the first call that we could not award funding to, and so they will decide before the end of this year, on what the call will be, and they will aim to issue the second call before the end of the calendar year. But the exact nature of that and what all it will cover is still under discussion. On the lessons learned, yes. So the what we call the stock taking review of the Pandemic Fund, which will be conducted over the summer, that will absolutely, the purpose of that is really to learn, One aspect of that is learning on the governance and the administration and so on of the Pandemic Fund, but another important aspect of it is also lessons from the first call. We want to hear from a wide variety of stakeholders what their experience was, and build those lessons into the design of the second call for proposals. On the question of the joint external evaluation, so if you look at the documentation that was put out for the first call for proposals, there were many criteria. I just mentioned the broad ones, but there were kind of sub criteria. And there was a whole section on results framework, and those were really based on the JEE, kind of the relevant JEE indicators that apply to pandemic prevention, preparedness, and response areas that were covered under the first call. So, JEE was at the center of this, but we also recognize that there are some countries that haven't done JEE. So then, they were asked to describe in their proposals, their national action plans and how they're performing. But I think the question was, did the countries that have weaker JEEs, have lower JEE scores, did they in any way suffer? They didn't. But I would like to ask, if I may, Dr. St. John, if she can also sort of chime in on this one, because I think, the Pandemic Fund right from the beginning was very conscious of the fact that, we don't want countries that are weaker to suffer. In fact, we want to support countries that have lower capacity. So maybe Joy, if you would want to come in on that and just share your perspective. Thank you.
Thank you very much. And I really am glad that someone asked this question early on. Priya talked about how much work the Secretariat did before the proposals were sent to the TAP to ensure that there was completeness of information. It was almost matched by the requests from the TAP after they'd seen the proposals for additional information to try to understand just this issue of, are we really understanding this country? If we don't have enough information, can we find it? The TAP searched on the web, they couldn't find it. They would go to the Secretariat and ask for information so that we understood precisely where this country was. Yes, the JEE scores were part of the review, but we also tried to use as many globally recognized indices as possible to understand the country or the group of countries or the proposal. And we also put lenses of understanding about a region or a vulnerability to the possibility of the development of pandemics into our discussion, that One Health perspective. We would talk about the number of a particular type of animal that there would be in this region, which would make the risk higher for developing pandemics. That was the level of discussion and the level of detail that we drilled down to understand every proposal. So yes, we understood that a country that is well-resourced is going to possibly send in a better proposal. And we are going to start very soon meeting, because the TAP was so seized with the need to lend their understanding of some of the weaknesses in this process. We soon going to start meeting to put together like a dossier of things we think would help in the next round. So yes, we did everything we could within the bounds of the criteria. We did everything we could, including asking for more information after we got the proposals, to ensure that it was a level playing field of evaluation.
Thank you, Joy. And I just second that. That's really a lot of attention to precisely guard against the question that was raised, which is you don't want the countries necessarily that have the capacity just to write a better proposal, to benefit while weaker countries lose out. And again, that's again the reason why the board also, emphasized that 75%, ended up support, and 75% of the projects are low and low middle income countries. And that was a kind of that was the first order of priority to support countries that, have, are low income, lower middle income, rather than just ending up supporting, middle income and upper middle income countries that, can prepare good proposals.
I need to say one thing because I'm reading the comments real time. And there is a comment that refers to reliance on online review. When the chat went back to the Secretariat, we asked that the proposal, the persons who submitting the proposal would be asked certain questions. We didn't do it directly, but the Secretariat did it. So it wasn't shooting in the dark. We were going back to the people who had presented the proposals. Over.
Julie, any other questions you would like us to address? I should also acknowledge my colleague, Catherine Hudak from the Secretariat has also joined. We have Cara, we have Catherine, we have myself. Anything else?
I know that we want to appreciate all of your time, Priya, and I know that we want to make sure we also have time to allow the countries to share their own experiences. My proposal is that we collect the rest of these questions and comments, many of which speak to the technical process of preparing proposals and looking for greater understanding moving forward of what has been learned from the first round about guidance for preparing the proposals. Perhaps there was another thought about perhaps options to provide technical assistance to the writing teams, as is done with Global Fund proposals. I would propose that we collect all of these, share them with your team at the Pandemic Fund Secretariat and with the Sustainable Financing Action Package. And we could post these comments along with the presentation after this and have some follow-up if possible.
Sure, I think that would work well. And maybe because just noting that this is a sustainable financing group, I do want to highlight that one of those 6 criteria that I ran through very quickly that were looked at, and again, all of that is in the public domain, but was, the country's capacity, the country's own ownership, the co-creation of the project, its willingness and its ability to, sustain whatever investments we make through the Pandemic Fund, because we recognize that, we're in this for the long haul, and that the grant amount, that's why there was so much emphasis on, the grant amount being supported by co-investments by the countries themselves, but co-investments, can be both financial, but can also be policy related, and how countries themselves sort of are anchoring this support in their own action plans. So, a strong focus on sustainability, and I hope that will come out in the next session that Mukesh will be moderating. But from our perspective, that's something that we've kept front and center, because we recognize that these are not one-off investments. So we start the process, we catalyze. The Pandemic Fund is meant to be a catalytic instrument, but we want to catalyze both funding and policy commitments. So I think the first call for proposals has demonstrated a lot of that, but we will continue to learn and grow and feed all of that into the design of our subsequent calls. So thank you very much, and looking forward to any questions that you may want to send in to us later on. Please do share them, because they will also help us think through, and we'll be happy to answer them in writing.
Thank you so much. And I think this is a place where the Sustainable Financing Action Package and GHSA can help amplify your answers to the member countries and organizations, and even more broadly, so that the information can be, the feedback can be provided following this event. Thank you so much, Priya. I do see someone has a hand up, but if I could ask, please, your indulgence, so we move forward and don't miss the opportunity to get the country feedback. We have another Q&A session at the end of this panel, and it would be wonderful if you could hold your question just until the end of that panel, so we don't shortchange the rest of this presentation. I would like to turn now to the moderator for our next panel, which will be on country experiences in developing these pandemic fund proposals. And I think that this is a great opportunity for the feedback that some of you have already provided in the interventions during the presentation on the first call. Our moderator is Mukesh Chawla. He is the Chief Advisor for Health, Nutrition, and Population at the World Bank and the coordinator of the Pandemic Emergency Financing Facility. So I'm going to turn over now to you, Mukesh.
Thanks a lot, and it is indeed a privilege to be able to moderate this roundtable. I'm an advisor in the health practice at the World Bank. The Pandemic Emergency Financing Facility, as we all know, closed last year. So just to kind of, set that record right. I would like to start by introducing my three very eminent panelists. I will be very brief in the introductions and then spend most of the time in giving them an opportunity to speak about their experiences. So we have with us Dr. Lisa Inder. Dr. Lisa Inder is the Director of Surveillance, Disease Prevention and Control Division at CARPHA, that is a Caribbean Public Health Agency, and has umpteen years of experience of regional and international management and execution of public health surveillance and response programs, and currently is a technical lead for CARPHA's multifaceted regional health response to COVID-19. My second panelist is Dr. Mebratu Masebo, who is a senior advisor in the Ministry of Health of Ethiopia, and spends most of his time in thinking on health security and public health emergency management. Dr. Mebratu is also the coordinator of the national COVID-19 response, and in that process played a critical role in leading the national strategic response to COVID-19. My third eminent panelist is Professor Claude Mambo Muvunyi, who is the DG of Rwanda Biomedical Center and the Professor of Clinical Microbiology and Lab Medicine, has also lots of experience with technical, managerial, and strategic management in the field of clinical and public health, with special focus on microbiology, the clinical microbiology, lab systems, service strengthening, and global health security. I'm going to kick off by asking all of my panelists, I will kind of give them just a couple of minutes first to reflect on the experience, their country experience, just in a couple of minutes, some of the highlights of that experience. Then I will turn to some very focused questions for each of my panelists, and then I'm going to end my part of the moderation of this group by asking all of the panelists that if there was one thing that you would like to see different as we get into the next round in terms of the process, what would that be? So just three very small, very simple segments, no more than 2 minutes each, because I would like to leave a great deal of time for the audience questions. And I saw many of those in the first round, and I'm hoping that there will be many, many questions even now, since we have three very eminent panelists. So Dr. Inder, just in a couple of minutes, just some reflections on the process, on how everything went for you, particularly given that you had a massive regional program and proposal, coordination, management, and that must have been quite something. So just some brief thoughts on that, Dr. Inder. No more than 2 minutes, please. Thank you.
Good morning, or good afternoon, depending on where you are, everyone. Okay, so CARPHA submitted a regional proposal as opposed to a multi-country or a single country proposal. And the reason we would have submitted this proposal, because CAFA is the sole regional public health agency for the Caribbean region, and we serve 26 member states. And we are mandated by our heads of government to be able to, to provide response to public health emergencies, which would include pandemic response. In terms of our proposal, in terms of a regional entity, the first question is asked, why a regional proposal? And the reason for the regional proposal is the commonality of issues faced by the Caribbean region. And those commonalities is that we are small, we have very porous borders, we have varying levels of capacity in terms of for pandemic response. That is our epidemiological surveillance, our laboratory surveillance, our workforce development. We are also highly tourism dependent. And as we know, diseases knows no boundaries. So the influx and spread of diseases through travel in and out of the Caribbean is at higher risk because of the fact that we are highly tourism dependent. So all of these factors, plus we are faced with a wide spectrum of diseases, including vector-borne and foodborne and others. It really predisposes us, that combination of factors predisposes us to have that regional approach. And the regional approach means regional coordination with our 26 member countries, because you need to be able to support all our countries together. If we build capacity in one country, because diseases knows no boundaries, because of that need to build in the region that functional capacity, if we build in one country and it's not in another country, then there's a risk still for inadequate pandemic response. So we would have submitted that regional entity for all of these factors. And the biggest part of all of this was working through our different countries and our different governance bodies to make sure they are aware of what is happening, that we got country support, 8 regional agencies support, our executive board, our ministers of health support, and to be able to address this in a systematic way, building early warning and response surveillance systems, building laboratory systems, building workforce capacity. But cross-cutting in that is the integration, the integrated One Health approach, which CAFA would have started years ago by, integrating the way we work, integrating lab and epi and environmental health, and then also building and strengthening the laboratory capacity, like the sequencing and the AMR capacity, not for one particular disease, but across the board. So I think I may have passed my 2 minutes. Let me stop there for now. We're not hearing you, Dr. Chawla.
Moving now from a 26-country proposal to a single country proposal. And I would like to invite Ato Mebratu, if you could share your thoughts on what the process was in Ethiopia. How did you go about setting this up? And in coordination, particularly between the Ministry of Health and the Ministry of Finance. So Ato Mebratu, the floor is yours. I can't hear you.
Thank you.
Good.
You
good.
hear me? Thank
Yes.
you. Thank you so much for having me. And I'm very much privileged to discuss our experience on the proposal development, starting from expression of interest. I think I'm really grateful with the speech and the presentations from Pandemic Secretariat, and also which was very much aligned with the expression of interest, and then the description that we had on the process of the development. I think it helped us very well to have a kind of country coordination mechanism which will help us to come up with something which will work going forward. So with that description, is the proposal guidance we get from Secretariat, we came up and to see from certain implementing entities, then we try to work with even including other proposals working in country at the same time. Like, for example, we have World Bank other proposal development at the same time. We have Global Fund, C19RM funding. So we try to balance and see the priorities differently from one proposal to another to avoid duplication. So we selected, I think, 3 implementing entity at the first, with WHO at the forefront to work with UN tripartites, with FAO and the UNICEF. Then we did our homework inside before even we go to other areas. So we try to identify what are our gaps in from our recent JEE, State Parties Annual Report, which we do every year, and also 717 timeline assessment, which we do with Resolve to Save Life for the last 3 consecutive years. So these assessments are very much helped us to identify the priority and the areas which we want to prioritize. Then multisectoral One Health comes at the forefront, which we lack from most of our JE capabilities. So with this, like our project even named as the Multisectoral Pandemic Preparedness, Prevention, Preparedness, and the Response Project. So we started with One Health concept and called up Ministry of Agriculture to work with us, Ministry of Environmental, the Commission of Environmental Health Protection also, then the implementing entity, which I mentioned already. So we come up as a core team. We had core team and like multi-agency team. So we had 2 layers. Then we did the core identification of the gaps. Their gaps are many, we all know, from developing country and as a country as Ethiopia with multiple needs, but we try to prioritize some top gaps at the first. Then we try to formulate that in expression of interest and then later on the proposal. Also, it's not only coordinating multi-agency, it's coordinating the action of the ministry and the some of the specialized entity in the ministry, including Ethiopian Public Health Institute, Ethiopian some research institutes, and the animal health institutes also are there. So we brought all entities together, and that's how we started, and the academia and the others are included. The last one is to make it inclusive. We try to reach out most of the partners, the CSOs, the bilateral and multilateral NGOs in the team to write with us, to see the priorities and to come up with some functions they don't cover on the process. So that's how we make the consent frame to write up the proposal, and we did this for many times in the same room. Thank you.
Thank you so much, Dr. Mebrahtu. I'm sure there are many questions that we will be coming back to you very soon, time permitting. But I would like to turn now to Professor Cloud. Give us some thoughts. Rwanda had a strong proposal, which was highly recommended. But give us some thoughts of how did you prioritize which activities to include in this proposal? There are so many things. The JE itself covers, I think 19 different functionalities. How do you decide and how do you prioritize across different possible interventions?
Thank you very much, Mikash, and thank you very much for providing to Rwanda the opportunity to share the experience of developing this proposal. Our experience are very similar to what has been described by my colleague from Ethiopia. But again, for Rwanda, there was some little bit difference in terms of really how did we come together to have some priorities. And first of all, I think if you all recall that during the first call, I think in Rwanda, we had 3 institutions that submitted a letter of interest. So there were Rwanda Biomedical Center, which is one of the main implementing agencies, ensuring that in the side of health, I think we are well prepared for pandemic. So I think this is how RBC submitted the one proposal. Another proposal was submitted by another letter of interest was submitted by the Rwanda Agriculture Board, which is also another implementing entity under the Ministry of Agriculture and Animal Resources. And the last institution that submitted one letter of interest was from the University of Rwanda, which is an academic institution. So I think from the time where we were all provided recommendation to proceed with developing a proposal, we really thought that it would be good to come together and to develop one proposal, coming together from different needs, different priorities, and bring it to one priorities. And as you mentioned clearly, that we firstly had to take the lead as Rwanda Biomedical Center, and also relying on our existing platform like the One Health technical team, where we reach out to all the PIs, the people who provided, who submitted a lot of intent from different institutions. And that's, I think, Rwanda Biomedical Center took that lead to really bring all those different stakeholders together and really, first of all, going it through their letter of intent, but also aligning with our GE, but also our action plan for national health securities. And so based on that, because we had very many lists of needs, but we had to really come together and brainstorm and discuss on what can be our priorities. And those priorities were firstly coming from those letters of intent, which were different, but also this was a good opportunity to really prioritize, but not really duplicating our effort, but really understanding very well what are our needs that is really aligned with the One Health approach. Is that where we need to focus? Because we had the One Health approach, One Health strategic plan, which I think was until when we were writing the proposal not supported or not funded. So I think we really understand that we have to agree on really understand those gaps and really align with the current proposal. So that is how we started. It was not really an easy process, but through this partnership and also collaborations, we managed to really come up with a list of priorities. And from those list of priorities, which were driven by the letter of intent, but also the One Health strategic plan, but also the national plan for health security, we identified those risks, but also as Rwanda Biomedical Center was experienced in writing other proposals for Global Fund, that was very supportive, beneficial for the team to now really also understand what are other resources on which we can leverage. So I think, and after that consultative meetings, we also had to engage with implementing entities, as my colleague from Ethiopia mentioned, so WHO, FAO, and also UNICEF, and later on also involving other civil societies and other NGOs, which are also very important to support our comprehensive gaps, not only for pandemic, but of other health system gaps. So I think this is a brief how our journey was, but I think it was really transformative, but also it was really a good opportunity to really emphasize on the importance of partnership and also this expertise that we can get from different stakeholders to have a very impactful proposal. Thank you very much.
Thank you, Claude. Just stay for a second. One more question for you. If you could speak a little bit about the engagement with civil society and the private sector, if any, and what was the experience with that? Very briefly.
So thank you very much, Mukash. I think we rely on our existing platform on which we engage all civil societies, that because we have a long experience in applying for Global Fund, for example, where we have those coordination mechanisms where we have regular engagement with the civil societies. And to our surprise, I think we were really also very surprised to see all those civil societies taking the lead to approach us, because we know that everything is very structured in Rwanda, where Rwanda Biomedical Center is very key in really working with different CSOs, depending on the areas of expertise. So everything is really coordinated under a strong institution with good governance. And under this Rwanda Biomedical Center, we also have other programs, related divisions or programs, which I think has a formal communication with different CSO. And for this, I think it's very easy to really leverage on this proactiveness of our CSO to come and approach us. And I remember that we also had meetings during which we had all the CSOs and NGOs that we have in Rwanda to really again discuss on this pandemic fund and really hear from their view, their reflections, and how they could support also the writing process of this. So I think this was really something that we had the opportunity to rely on the existing mechanism and relationship that we have already with the existing CSO in Rwanda.
Thank you. Thanks a lot. Ato Mebratu, the same question for you, particularly the private sector. What's your experience with bringing the private sector into this engagement, if at all? And if not, then what are your plans as you move forward? How do you bring in the private sector, both in this conversation as well as in active engagement during preparedness? We know that during response, the private sector played an extremely important role in Ethiopia, but I'm talking about the preparedness phase. Over to you, Ato Mebratu.
Thank you. So I cannot say like we engaged enough because that's one of the area we really learned from COVID, that strong engagement of private sector, both on activities, on the function of the responses, and also preparedness level is very much important. So we try to approach some of the innovative private partners to come up with their innovative idea, and we try to include those on our proposal. For example, one of the proposal we had was some innovation to reach to the rural community in continuation of essential service on time of kind of pandemics, and that will help for preparedness of identification and detection in pandemic preparedness. That's included in the proposal. But so the proposal was somehow very much focused on some of the selected priority areas, but in the implementation, I think we are planning to add on the consent term. Already we made for proposal writing, and the implementation will add other CSOs. The private partners will sit down and plan accordingly every year on the project implementation. And the good thing for this pandemic fund is it's not only about the proposal we wrote or the funding will receive from pandemic fund. It's a catalytic funding as described by the previous presentation. So there is already much more engagement. We already started, and that umbrella can be bigger with the engagement of more CSOs, private entities, private non-profit individuals, and some organizations, which I think my friend from Rwanda said that we have a very good experience in global fund country coordination mechanism to bring those CSOs and the national, local level organizations and the forefront for preparedness, and as well as for future response if any case happens. Thank you.
Thank you. Thanks a lot, Lisa. I continue to be hugely impressed, but also puzzled. How do you bring 26 countries together? So what kind of a system do you have? You have a big office with 26 country reps sitting in the same office. How do you decide the different priorities, and how do you allocate responsibilities and resources and coordinate and manage and report? So just talk a little bit more about this. Well, this is, I think, the largest regional body that I've seen so far, and the process of getting 2 or 3 countries together, or 2 or 3 different groups together, can be challenging. And here it is, 26 countries, and I can see that Joy has a very happy, smiley face on that one. But before we go to Joy, Lisa, to you.
Yes. So it's how CAFR first is set up. as I said, we are the regional public health agency. This year makes it 10 years, but our predecessor would have been CAREC, the Caribbean Epidemiology Center, and other regional entities. But we are set up in that we have a structure where we have an IGA, intergovernmental agreement, that really has all these different countries signing on to the different functions of CARPA. And for all the reasons I said before, we are so small, collectively, our populations are much smaller than some one country, and we really need that regional approach. So the way how we are set up, we don't have this huge amount of people, but what we have are regional coordinated mechanisms, and we work very, very well with our countries. So first, starting to the way how we are set up, our technical departments, we have 11 major technical departments: communicable diseases, emergency, that fits into emergency and response, vector-borne, travelers' health, a field epidemiology training program, and a range of other surveillance. And then we have also non-communicable diseases and drug testing and so on. As a regional agency too, we have a regional reference lab for human infections. And we also have a regional reference lab for food and waterborne, as well as drug testing. So our structure and our different programs allows us to have that regional approach. When we work with countries, we work with all our countries. Our first level of communications is with our chief medical officers. So we would have, of course, email and listing groups and so on, but we also have a WhatsApp group, and we speak to them daily. So it's one of our best ways of communication. And, my executive director is very good at that in terms of making sure we are communicating. And then we have something called a regional coordinated mechanism for health security. That mechanism allows us to pull together our countries and the different agencies, because as in other countries or regions, you have many different entities that are involved in pandemic response. So for instance, while CARPA is a regional public health agency, we work with, there is PAHO WHO that's working in the region. And then you have regional entities such like the SEDEMA and IMPACTS, all involved in pandemic response. And international agencies like the Center for Disease Control, Public Health Agency of Canada, the GHSA. So that coordinating mechanisms allows us to meet, to bring together and to speak, and to really come up with a coordinated approach towards pandemic response. And it's one of the first things we did when we wanted to do this application. When we were developing the expression of interest, the first thing we did is we called a meeting, of all the countries and our partner agencies to say, this is what we're doing, how do we do this together? So it was not done in isolation at all. We knew what the different gaps were, and we worked in a coordinated manner. The other thing that we have as a regional coordinating body is that we have a lot of regional meetings. So for instance, last year we had a regional health security meeting. That was really instructive because in that meeting we had 84 participants, which included all our countries, 25 of our 26 member states, as well as the different agencies. And they came up with priorities. So I know the question was asked about JE. Why we didn't have all the JE? We had a documentation of country priorities. And it literally is the same document, same type of priorities. The need for emergency and response mechanisms or real-time surveillance, laboratory capacity, workforce capacity. So the way we operate, we don't have a lot of people, but we have committed, dedicated people, and we work through our different networkings. We have a set of different types of networks and bodies that we work through, and that also includes the private sector. So for instance, in our tourism and health program, we work with the Hotel Association and so on, and we work with our global entities like the UNWTO. So mechanisms, networks, communication and coordination are some of the big instruments that we use to bring it all together. But it's exciting, Dr. Chow.
This is absolutely fascinating. You know, the next time when I come to St. Lucia to play cricket, I'll find some time to do a case study with you on this. This is amazing.
And I also like cricket a lot. So
there you go. Yeah. There you go. While you're still there, in just 1 minute, we are running out of time, and I'm now encroaching on Jose's closing. So bear with me, Jose. But in just 1 minute, Lisa, if there was one thing, just one thing that you would have, or that you would like to change in the process, or you would like to be seen to have changed in the process, or one recommendation that you would like to give to the pandemic board, what would that be? Just one, and very briefly.
So the issue of that agency coordination, how do we coordinate and work better so that we are able to better serve our member states and the region, and then globally as a whole. We have a lot of different agencies and entities like the World Bank and different partners, and like PAHO and others, and a lot of regional agencies. And the countries, so for instance, we serve a small set of countries, but I suspect it's the same for in other regions. So how do we coordinate with our international or regional, our national agencies, the universities, the civil societies, so that we are better able to serve in a coordinated manner? That would be the one thing that I think we could keep working toward.
Brilliant. Ato Mebratu, very briefly, one thing only.
Thank you so much. It's really good to really say but one. Then I think I will select the co-creation country ownership should be strengthened a lot, because we had 17 expression of interest from Ethiopia. So if others came through the country ownership, I think we did avoid that and use those all expression of interest ideas in one country expression of interest. I think that's one of the points. Thank you.
Thank you. And keep your videos on for the moment. Claude, same question to you. Thing only.
Thank you very much. I think in addition to what my colleagues have put as a recommendation, I think for us, I think this is something we have noticed for other many countries. I think we need some support. So we have good technical team, good institutions that can really come up with good ideas, good prioritization. But again, the writing process is where we struggle. And if you can get some support in terms of really having dedicated support from either the Secretariat or from the implementing entities to really support countries in the writing process, because that was one of the process that was really very difficult for us to really finish this process. So again, support is something we would really recommend for the next step. Thank you.
Thank you. Thank you very much for a very candid observation. And on behalf of all of the participants, the audience, the organizers, everybody, first, my apologies to the audience for not giving you an opportunity to ask questions, just running out of time, but I'm sure you have tons of questions. Please feel free to write to us even afterwards, as you have our emails. If not, you can just write to Julie or write to anybody, and we will certainly get back to you. We shall lean on our 3 participants and make sure that they find time to respond. But on behalf of everybody, if you can get your video back on Cloud, I would like to say thank you very much. Thank you for your time. Thank you for participating. Thank you for a very honest, candid session. And it's a learning process for all of us as we embark on this extremely important agenda. And we have had a fantastic start and look forward to it continuing to grow and get even better. With that, over to Jose with my apologies. I've taken 4 minutes of your time, so do forgive me, Jose, but over to you for your closing remarks. Thank you.
No, thanks, Mukesh, and many thanks to all the panelists as well. My remarks will be very short. The value is actually in the presentations and the discussions that we just had. So I'm here just to say thank you to first to Julie for keeping us organized, to Mukesh for moderating this panel, Priya for a great introduction and really running through the details of the Pandemic Fund first call for proposals, which I think is was an incredible presentation and really helpful to understand both sort of the nuts and bolts of the process. And thank Joy for coming in as well on some of the details around the TAP and sort of the attention to detail and the dedication that they showed in the evaluation process. And thanks so much to Dr. Indar, to Professor Claude, to Dr. Mabratu as well, really providing a lot of valuable insights, both the approach in different settings and different experiences to the development of a proposal and to engaging partners as well, some of the challenges as well to pull some of the materials together, but also understanding the coordination process externally. So both internal and external coordination, which is always a challenge, but also really important. And I think we got some really excellent perspectives and wrapped with some really helpful ideas on what could be improved. And I think this is probably one of the most important pieces, is to be able to feed as much information back and ultimately to the board as possible, so that Secretariat, so that the process can be strengthened moving forward and countries can maximally benefit from this pandemic fund opportunity. So with that, I do want to say thank you again to everyone. I thank the audience for who showed up sometimes in an early time zone, really to take full advantage of this, and the organizers for this webinar as well. These clearly are very valuable. And with that, I'm happy to wrap things up. Thanks to everyone again, and we will follow up with a meeting report. As Julie mentioned, this event was being recorded, so that'll be made available on our website as well, for those who couldn't make it or want to review. And you definitely will see the presentation as well. So with that, thanks again very much and have a good rest of your day.
Thank you.
Thanks.
Thank you.
Bye-bye.
Thank you. Thank you. Thank you so much.
Bye.
Bye.